The next 3 weeks of this course will be dedicated to electrical modalities. We will be discussing the role of electrical modalities in rehabilitation, and I'm super excited about these next 3 weeks of the course because we currently utilize electrical modalities often in our athletic training clinic and also in our physical therapy clinics as well. So what we also know is that if we look at our textbook and if we look at the majority of the modalities on our syllabus, what we will see is that a lot of what we're discussing in terms of modalities is really electrical in nature, right? What I find interesting is that electrical modalities have the capabilities of taking an electrical current, which is flowing from a wall outlet, and modifying that current to produce a desired physiological effect within human biological tissue. If you're not excited, I hope you're getting excited now. But I also think it's important that before we can begin to discuss those specific electrical modalities, that we have a basic understanding of the electricity principles that will help us modify and produce our desired physiological effect within our athletic patient population. So therefore, I believe the purpose of this online lecture is really just to get you guys acquainted with the basic principles of electricity. Stop number 1 is the atom. What we know and what we've learned from chemistry is that all matter is composed of atoms, right? And that these atoms contain both positively and negatively charged particles, and those particles are called ions, right? And so when we're looking at the atom, and this atom right here, what we'll start to see there are several different structures that are labeled. We have our red ions, which are called our protons, and those are positively charged. We get our green ions, which are our neutrons. And then when we look at the blue negative ions, those are what's most important with electrical principles, and that is our electron ion, which is negatively charged. So the ion of specific interest is the electron, this little guy highlighted right here. Why is it of specific interest when applying electrical modalities? Well, the big deal with the electron is that it is the one particle that is capable of possessing a negative charge. It is capable of moving or jumping ship, per se, for lack of better words. It is capable of jumping or moving to different orbits, right? And so when we think about an electron moving from orbit to orbit, what we tend to see is this production of energy, right? Electrical energy that can be applied to human biological tissue to manipulate it, to change it, to alter the pH level, right? To get a desired therapeutic response within our patient population. So the atom, why is it important? Why do we care about it when it comes to electrical modalities? Well, if it weren't for the atom, electrical modalities truly would not be capable of producing therapeutic responses such as reducing edema, such as increasing muscle strength, such as reducing pain within our patient population. So when we talk about the atom, I think it's important to understand its role, specifically the ions. What we'll start to see and what we're going to discuss right now is this idea that the movement of electrons always goes from a higher potential to a lower potential, right? Or another way stated is that it moves basically from a negative or a cathodal environment to a more positive or an anodal environment. And so this movement of electrons from a higher potential to a lower potential environment is referred to as electrical current. Does that sound interesting to you guys? So in its simplest form, what we can say is that an electrical current takes the path of least resistance, and it always goes from the negative pole, which is the cathode, to an area of higher electron, from an area of higher electron concentration to an area of lower electron concentration and a more positive environment. When electrons are allowed to flow from this higher environment to this lower environment, we get the production of electrical energy. And it is this movement of electrons that allows us to actually get a desired therapeutic response. Whatever that therapeutic response may be will be patient dependent, right? Or goal dependent. So remember that we said that electrical currents result when we have a flow of electrons from a higher potential area to a lower potential area, and that creates an electrical current, right? And so when we think about electrical currents, what we have to think of is this idea of the electrons, right? The number of electrons that are going to be required for current. It's so great that it's impractical really to count each of these electrons. And so what we consider or what we think about is this idea that when we have a large number of electrons, that these electrons can be described as a single unit, right? And so that's what we see here. And that single unit, more specifically, is really called a coulomb. And it is used to describe the charge produced by about 6.25 to 10 to the negative 18th power, right? And so this overall concept, both here and here, represent the basic unit of charge, right? And so what we get is a coulomb, and that coulomb represents, remember, it's representative of the number of electrons that's required to produce an electrical current. And so with this coulomb comes something more specific, which we call Coulomb's law, right? Of course, there's always law associated with anything electrical. And so Coulomb's law basically says what we already know, and that is that like charges tend to repel one another, and that opposite charges, right, on the other end of that spectrum, so if we're looking down here, tend to what? Like one another, right? So in essence, like charges are going to repel, opposite charges are going to attract, and it is really this attraction or repulsion that gets amplified by increasing the magnitude of the charges and or decreasing the distance between the two objects. Specifically, when we think about electrical modalities, that'd be decreasing the distance between the electrical paths themselves. When an electron moves from the higher potential to the lower potential, we get what is called the potential difference, right? And the potential difference really is a measurement of the tendency for current to flow, right? And this is a good thing when we're thinking about it therapeutically. We want to know how is it possible that current could flow through our patient's, let's say, epidermis and dermal layer to get to the target tissue, which is typically either going to be the muscle itself and or the nerve. So our A betas, right? We want to stimulate our A betas to reduce pain in our patients. So we really want to know what the potential difference is. So this brings us to the volt. The volt is a unit of potential difference. It really represents the amount of work required to move one coulomb of charge. Remember, a coulomb is basically an accumulation of a number of electrons that are capable of producing some type of electrical current, right? That can be delivered to our patient to produce a therapeutic response. So how much energy is available in our system and how much of that energy can be delivered to our patient to produce a desired therapeutic response? It may seem as though the flowing or the movement of electron from one orbit to another is really a simple task or a simple movement, but it really truly isn't. This flow really consists of moving or passing the electrons from one atom to another. And so when we think about this in its most simple form, we can kind of think of individuals who are passing a water bucket from one person to another, where the individuals who are passing the water represent the atom, and then the buckets being passed represent the electrons, right? And so we can say that when we have an electron moving from orbit to orbit, that it really truly does take a lot of effort, a lot of energy, and a lot of work for that atom to move from a higher potential area to a lower potential area. So that's just one way to think about electrons moving as they're moving to produce energy, specifically an electrical current. So our next stop on the electrical principle train is the discussion of Ohm's law. And basically Ohm's law is really the relationship between amperage, voltage, and resistance. And so let's go ahead and just define voltage all over again. Remember, it is the potential difference between two different poles, right? The cathode and the anodal pole. And it's basically the measurement of the tendency for for current to flow through our patient's biological tissues. So when we take a look at Ohm's law, what we're looking at is this relationship, so that we say current really is directionally or directly related to voltage, right? And so when we think about this clinically, this makes a lot of sense. When we think about voltage, we can think about it another way. Voltage being the intensity that we are applying the electrical stimulating current to our patient, so that if we increase intensity, then obviously the current of that electrical modality is also going to increase as well. But on the opposite end of the spectrum, what we also have with Ohm's law is this idea that current, the current is actually inversely or indirectly related to what we call resistance, right? And so remember a few slides back when we talked about resistance being met with the skin, specifically the subcutaneous levels of the skin. And so we could say, okay, if we have increased resistance at the skin, then the odds of current flowing through our patients to produce a therapeutic response might be limited, right? And so that's where we as clinicians can do things such as clean the patient's skin with alcohol, have our patient shave so that there is less resistance which allows our current to flow through our patients more succinctly to produce a therapeutic response. So what is amperage? Amperage is the rate at which electrical current flows. So why is this an important principle for therapeutic modalities? Well, very simply stated, we want to make sure that our current is flowing at a rate such that it produces a desired therapeutic response. If the rate is very low, then it's not high enough to overcome tissue resistance, and therefore we do not get the desired therapeutic response that we would want, or that would be the goal of our treatment for a particular patient. So when we think about amperage, what we have to kind of think about is this idea that amperes really do dictate the outcome of the treatment. So 1 ampere is equal to 1 coulomb, right? And remember, when we talked about coulombs, a coulomb is a basic unit of charge, right? Specifically, as it relates to the electrons, it represents a large number of electrons and their associated charge, so their ability to deliver electrical current to the biological tissues. So 1 ampere is equal to 1 coulomb passing a single point within 1 second. Why do we need to know this? I think it's important to know this so that we're able to manipulate our parameters such that we get the desired therapeutic outcome for our particular patients. So for Ohm's law, what we basically have said is that it represents the relationship between amperage, voltage, and resistance, right? And we said that current is directly related to voltage, and then we've also said that on the opposite end of that spectrum that it's indirectly related to resistance. And so with Ohm's law, we have to understand some key variable factors, and those variable factors are I, which would represent the current, then we also have V, which would represent our voltage, and then last but not least we have R, which would represent the amount of resistance that the current is encountering at the patient's biological tissue. And so some formulas that we begin to see is that current would be voltage divided by the amount of resistance encountered at the superficial tissues of our patient. That voltage would be equal to the amount of current flowing through the patient, and also the resistance encountered between the electrodes and our patient's subcutaneous tissue. And then we have resistance, which would be represented by the amount of voltage being applied through the electrical modality divided by the amount of current flowing through that electrical modality as well. What you can kind of observe just by looking at these is that all of these variables are interrelated, right? Such that if we manipulate one of them, then we are also somehow changing the way that these variables work, right? So for example, if we increase voltage and we decrease resistance, then what we can kind of see is that the intensity of that electrical current is going to be increased, right? And that's really ideally what we want when we're utilizing electrical modalities for therapeutic purposes. So that brings us to the principle of resistance. When we're talking about resistance, there really are two different terms that we're going to refer to. Those tissues and or items that are conductors. And then on the opposite end of the spectrum, we have those tissues and or structures that are resistors in nature. And so we think about a conductor, that's biological tissue and or some type of material that is capable of passing on current. This is ideal, and we want this to occur because we want to have electrical stimulation or the electrical modality being passed from one tissue to another depending on the desired therapeutic response. But on the other end of that spectrum, we also have resistors within the human body that oppose current flow, and we really want to limit their opposition if we can, so that we allow electrical modalities to be delivered to the desired tissue during our treatment for our patients. So what are the conductors and the resistors that we face when we apply an electrical modality? What you'll start to see are some of the similar offenders, the biggest offender probably being the skin, but and the adipose tissue, right? So the electrode is always going to be a conductor. Then we have our adipose tissue, which is going to be an insulator / resistor. And then we have our excited tissue, right? So our nerves, our musculoskeletal system, specifically the muscles. And what you'll start to see is that our excited tissue, such as our muscles and our peripheral nerves and the electrodes, are really, really good at generating and delivering electricity to the biological tissue. What's interesting is that the primary biological resistor to electricity is the human skin. So what we have to start thinking about is ways to improve the environment in which we are utilizing our electrical stimulation. So we just talked about resistance, which, as you guys will recall, is either the ease with which current can pass or the opposition to current flow. Next on our stop is the concept of impedance. With impedance, we have two terms that we really talk about. One, which we spend a lot more time on. So we have the idea of inductance and capacitance, right? And so inductance really relates to this ability to store electrical energy by means of an electromagnetic field. On the opposite end of the spectrum is capacitance, which represents the tissue's ability to store energy by means of an electrostatic field. And when we're talking about electrical modalities and therapeutic intervention, really we're worried about the tissue's capacitance, right? This determines the effect of current flow within the body. On the other end, with inductance, really not concerned about it too much. So the majority of what we'll talk about will really be related to tissue capacitance and its ability to. So last but definitely not least is the idea or electrical principle of power. We talk about power, we think of someone's ability to lift something or the ability to produce something with a large force output. But when we refer to electrical modalities, what we're really thinking about are two different concepts of power. That first one really has to do with amperage or amperes. And then the second concept that's associated with power is voltage, right? And so we've already said that an ampere is the rate at which electrical current can flow, right? And we've said that 1 ampere is representative of the current that flows when one coulomb passes a single point in 1 second, right? And so we have this representation of amperage, and then on the opposite end of the spectrum we have the voltage, right? And remember that we said voltage is the potential difference between the two poles. It's a measurement of tendency for currency to flow. So if we take the two and we consider what they contribute, we would say that voltage is going to describe the amount of work performed in a unit time. And then we're also going to say that amperage on the other end is going to be a descriptor of, what am I saying? That amperage is going to be define the unit of time that it takes for the power to actually be produced. Power overall really is expressed in watts, and so what we say is that 1 watt is equal to the amount of power produced by 1 ampere of current, right? And so we can see how the two concepts are kind of interrelated. Now, when we're thinking about this clinically, what does this mean? Why is power so important in the use of therapeutic modalities. What do you guys think? Why is it so important? Well, the big deal is that we really need to have enough power to produce, to stimulate our electrons to move from orbit to orbit. When we do this, we have the stimulation or the movement of electrons from the higher potential to the lower potential, thus creating current, right? And then with current, if we have a high enough voltage, right, then we could say that this current could be delivered to the desired therapeutic tissues. So in summary, what we find is that electrons move from areas of higher potential to lower potential. Those higher potential areas begin in the cathodal area and tend to be more negatively charged in nature, and then they tend to move to a lower potential area, which is known as the anode, and it tends to be more positively charged. When you get the movement of electrons from higher potential to lower potential, you get a potential difference, and that potential difference again is a representation of voltage. So in addition to the movement of electrons, we've talked about the Coulomb's law, which states that like charges repel one another and opposite charges attract to one another. And then last but not least, we have the principle of Ohm's law, right, which states that current is directly related to voltage. Now, if we increase voltage, then i.e. we kind of increase current delivery to desired therapeutic tissues. But on the opposite end of that current is indirectly related to resistance. So the more resistance that a current is met with, the less delivery of current we get to our desired therapeutic tissues. If you should have any questions, please feel free to email me and ask as you're going along. Good luck.